As an example of an online tool that helps people self-manage their disease and that promotes the involvement of people in their care, I'm going to talk to you about a tool that we developed for rheumatoid arthritis and that we're currently testing called the Arthritis Health Journal. So patient passports and similar tools, and they have a whole bunch of different names in the literature. Sometimes they're called electronic health records. They're called different things. They've been used in chronic diseases, and particularly in diabetes, to promote the active involvement of patients in their care. And studies have shown that they do lead to better treatment and to better health outcomes. In rheumatoid arthritis, and that's the target of the tool that we developed, the current approach, which we call treat to target, emphasizes the importance of regularly assessing disease activity. So how much is your inflammation from your rheumatoid arthritis still active, and modifying treatment until people have reached what we call the target, which essentially is ideally having no inflammation, which is called remission, or having only a little bit of inflammation that is what we would consider an acceptable level of inflammation. And until this is reached, you modify therapy until you get to that target. And that's because once we have that target, we know that then people are not going to be damaging their joints, and we reduce the risks of the long-term consequences of rheumatoid arthritis. So we thought that specifically for rheumatoid arthritis, if we had a tool that helped people assess their own disease activity, we could facilitate this approach, and that it could give people an early warning as to whether or not they've reached that target, or maybe they were on this target but they're slowly slipping away and it's time for them to go back and see their rheumatologist. So that was sort of one specific application that we thought could be used to a patient passport in the context of rheumatoid arthritis. So our objective was to develop a patient-centered online tool that promotes active involvement of people with rheumatoid arthritis in their own care in order to facilitate this treat-to-target approach. And specifically, we've called it the Arthritis Health Journal, it allows people to track their symptoms over time, to monitor how active their disease is, to keep a record of their medical information so that every time you go see a doctor, you don't need to kind of remember all of the medications you've been on and the things that have happened to you. And also, in terms of promoting self-management, to help people develop action plans to help them better manage their disease. In order to develop the tool, we conducted some interviews with 9 patients and 5 rheumatologists to get some input into developing the Arthritis Health Journal. And when we asked people with RA about what they wanted in a tool, they said that they wanted something that would help increase their self-awareness of their disease and of their symptoms, that would help them do self-management, and also give them an indication of when a visit to a rheumatologist was needed. When we asked rheumatologists, they found that a tool like what we were describing could improve patients' involvement in their care, and that if that patient data, so information that people would bring about how their disease has been over time, because we realize that we see you at one point in time, but in fact there's been months leading to that time, could also, and also if people could come to the rheumatologist prepared with specific concerns, that it could help to focus care. However, the key to that statement was that they wanted data or information that would be succinct, because they were worried about people coming in with pages of information that then they were worried that not only it's not just a matter that it would take time, but also that it would detract from other essential things that need to happen during the encounter. They were also worried, and so we took that into consideration when we developed the tool. They were also worried that having a lot of information, and especially if there was not with the information about what to do with that information, that it could actually heighten anxiety. And it's interesting because it's a consistent theme from what we've heard earlier this morning. And also they were worried about how adequately, this concept of wanting patients to be able to assess their disease activity, they worried about, well, how accurate is that assessment, and can it really accurately discern whether the disease is well controlled or not? So to develop the health, so we took those, and I'll sort of, as I show you the different parts, I'll show you, you'll get a sense of how we took that input into consideration. So we assembled a multidisciplinary team of researchers. We had rheumatologists, physiotherapists, we had a nurse, we had a social worker, and we had people with arthritis to develop the tool. We partnered with Microsoft Canada and TELUS Health Space to obtain a secure platform to store the health information that's inputted into the Arthritis Health Journal. We hired Habanero Consulting Group that is a design firm, to sort of design the look and feel of the journal. And then we collaborated with Vancouver Coastal Health for the IT service to actually build the tool itself, do all the programming. The tool has 6 sections. The first one is a symptom, allows people to track their symptoms over time and also to track their exercise. The second section allows people to assess how active their rheumatoid arthritis is. There's also a mood assessment tool, and you may wonder why did we do that on a tool on rheumatoid arthritis, and that's because there's an increased recognition that people with arthritis more often than the general population are at risk of having depression, and that often this can be rather insidious and people don't recognize it. And so having a tool that allows people to assess their mood can allow people to recognize when their mood is become if they're suffering from depression. And there's also specific resources that are available depending on and help interpreting the results of your mood assessment. There's also a section where you can record all your medical information, your medications and procedures and who you've seen, etc., and what the impact of it has been. And then there's a section to help people develop action plans from their goals for what they want to do about their health. And finally, a lot of this information is taken and generates a report. There's a report for yourself to track things over time, and a more succinct report that you can take that is aimed at the information that we thought that rheumatologists would want to know, so that you can take that you can bring that to your rheumatologist. There's nothing preventing you from taking the rest of it. You don't just have, but that was sort of a more focused information that we thought rheumatologists would want to use to assess how your disease has been over time. This is the landing page. I'm just going to show you screenshots of the tool. This is the landing page for the journal. And we came up with the name Arthritis Health Journal from the consumers on our group and from the focus group as well. We initially were going to call it a passport, but people didn't like that term. And it's really more of a journaling, because you're kind of journaling about your symptoms. This is kind of the, if you want, a little bit like the index of a book. So this is what tells you the different sections, and this allows you to access the different sections. And you can kind of click on the buttons when you want to update it. And then it also shows you when you last did it, so that if you're kind of wondering, oh, I wonder when I did this and if I should be redoing it. And I'm just going to take you through individual sections. So this is the symptom section. It sort of asks you a question about symptoms such as fatigue, stress, sleep, again, your mood, and your pain, and your stiffness. And it asks about it over the last 24 hours, and you can see the color coding of the answers, so that when things are good, things are more green, and when things are bad, they're more red, and there's kind of the spectrum from green to yellow to orange to red. And then this is the one on the exercise. It asks if you've exercised in the last 7 days, what kind of exercise you've done, how often, and for how long, so that you can keep track of your exercise. And this is an example of the health report. So this then gives you back what your symptoms have been over time, and you can see, and they're placed in one in relation to another, so that you can see over time, so the trends, have things been getting better or worse, but also how they relate to one another. In the bars like that is over time. Each time you've put in an entry maybe I'll go and stand over there. And here is your latest results, so that you can see what you last entered. And there's a little bit of an interpretation on the side. And you can choose over what period of time you want to be looking at your trends. You can do it's set as a default to the last month, but you could look at the last 6 months, or etc. This is the section on assessing disease activity. So it asks question, and this is a validated tool for people to assess disease activity using patient self-report data. So it asks about overall, considering all the ways your arthritis affects you, how would you rate that you're doing? It asks you about your pain. It asks, this is a measure of physical function. It asks about your ability to do different things. And again, it's the green when things are good, going towards the red when you're having more problem. And this is what we call a joint count. So it essentially goes over the different joint areas of the body and asks you to identify which areas hurt. And when you click on it, if you it's by default set at green. And if it's painful, you click on it, and then you'll have to rate if it's mild, moderate, or severe. And this is then used in an algorithm in order to calculate your disease activity. And depending on what it is, you kind of get this, if you saw it live in action, you get this little ball that rolls on it and then stops where your disease activity is. And then there's an interpretation of it. So for example, if you had high disease activity, as in this example, with a 7, it would tell you what does that mean, and it would tell you what should you do about it. And also on the graph there, you see the dates where you've entered your disease activity before and how this has changed over time. So this kind of suggests that you're going into a flare. This is the mood assessment, and again, it's a validated instrument for mood assessment. And again, sort of the red if things are not going so well. And I'm not showing you the final result page, but same thing, it gives you your score and what it means and resources to access if you might be experiencing depression. This is the brief action plan. And essentially, it's helping people take a goal and turn it into an action using the principle of SMART goals, which is specific, manageable, action-oriented, relevant, and time-specified. And it does so by asking you questions. What do you want to do? How much or for how long? Where? How often? When? And when do you want to come back and check it? And then it takes your answers in those boxes, and it populates the sentence at the top, which is what we call your commitment statement as to what you're committing to do over the next while. And then it asks you how confident you are that you're going to be able to do that, because we know that people's confidence in their ability to do their action plan influences the likelihood of them being able to do it. And if you're below 7, which is kind of the threshold, then you're asked, whether you want to modify it and if there's anything you could change in it in order to get a confidence above 7. This is the medical information section. So here is an example of where you enter your medications. What medication, what is it for, what's the dose, and then has it helped? Have you had any side effects from it? And then you can save that. And then on your report, you can see all your current medications, and all your past medications and why you've stopped them. Similarly, with your medical conditions, whether it's still something that's ongoing or just something that happened in the past, and any complications or problems with it. And this is an example of the report to your doctor. The first section allows you to think ahead of time about what are the concerns you want to raise in your next appointment, and it comes up with 2 concerns. And then it shows your disease activity, and it shows it over time, and this physical function measure that I showed you before, because those are 2 measures that the physicians are used to seeing in terms of assessing disease activity and monitoring progress of arthritis over time. So where are we at with this research right now? So we've done completing the tool. We did usability testing, which means that we asked people to use it, to think aloud while they were using it. We did a cycle, we modified it, and then we did a second cycle. And people found that we used this measure of system usability scale that tells us how user-friendly it is, and we had good results at 84.7. I have to speed up a little bit. What were the lessons learned from the usability testing? So what people like was the ability to view patterns over time and the relationship between the symptoms and other aspects of their disease. They liked the fact that it was represented as a graph over time, and that you could customize it. I didn't show you that, but you could add symptoms that were concerns to you not just the ones that were predetermined. We did need to pay more attention to format. We thought our format was clear, but we still had to change it. And interestingly, even though we thought we had limited text and we're used to people not reading things on paper questionnaire, well, it seems that online people read even less. So we really had to take all text away and just have extremely succinct information. Next steps, what we're doing now is we're doing a pilot test of the tool. We are recruiting 50 people. 25 will use it right away. 25 will use it in 6 months. So then during the period of waiting, they serve as a comparator group to the groups who are using it right away. We want to assess how feasible, how useful, and how satisfied people are with it. But we also want to see how does it contribute to patient-centered care. We were measuring things that are called things like consumer effectiveness, communication, satisfaction with care, and shared decision-making and patient self-efficacy. Just want to acknowledge the co-investigators on this program, many of whom are in this room, and that this was funded by a peer-reviewed grant from Canadian Initiatives for Outcome in Rheumatological Care, which is from the Canadian Rheumatology Association.